So hello friends, welcome to my new video. So today in this video I'm going to discuss with you all about retinopathy of prematurity. Okay, so let's start. So before going to the discussion on this topic, first of all, let's have an idea about what is retinopathy of prematurity. So from this term we can easily understand that retinopathy of prematurity. So retinopathy means pathology of the retina, and prematurity means due to premature stage. So from this we can understand that due to that premature stage, the retina is some pathology or disorders it can be seen. So that is known as retinopathy of prematurity. Okay, so now let's move to another next slide. Is that so some common term that you need to know in to understand about what is retinopathy of prematurity. So first of all, it is chronological age. So what is chronological age? So your current age is your chronological age, means the date or the day when you take birth, and the current or till date is known as chronological weight or CA. Now what is GA? So GA means that the date of the last menstrual, okay, of the mother, and the day of the delivery. So that in between the duration, that is known as gestation age or GA. Okay, and post menstrual age, what is it? So post menstrual age means the combination of the chronological age and gestation age, that is known as post menstrual age. Now let's move to the next slide. Is that okay? So here I am discussing about what is the normal retinal development. So to understand what is the abnormal retinal development due to prematurity, first of all we need to know that what is the normal retinal development. So for that, first of all, retinal vessel arise from the hyaloid vessel from the optic disc and began to migrate outward within 16 weeks. So from this we can understand that from within 16 weeks the retinal blood vessels start to migrate the retinal periphery, and it ends or complete, that means at about 36 weeks the blood vessel reaches to the nasal quadrant or nasal portion of the retina, the complete blood vessel development. And in between the 40 to 42 weeks, the blood vessel complete its distribution to the temporal retina or temporal side. Okay, so what is retinopathy prematurity now? So suppose a baby is born in 30 weeks or 34 weeks. So what happens is that the vessels, that means the blood vessels, are not properly distributed to that child, and he take birth due to certain reason. It can be any reason. So due to any emergency that there is a need to do an urgent delivery, so that child remained premature. So for that premature baby, the retina also remained premature, and that further lead to some complication if it is not treated properly or not look after the child properly. So in this slide you can see this child is premature child, and this is the retina that I will discuss with you all in the later slide. Okay, so here you can see a retinal picture. Here you can see that this is the vascular retina, and in the lower part this is the avascular retina. So what happens is that in the child is born 30 weeks or 32 weeks. What it means that there is two retinas or two parts are created. That means a demarcation line will create which separate the vascular retina from the non-vascular retina, okay, or avascular retina. So that demarcation line appear in stage 1 that I am going to discuss in the later slide. So how it happened? So first of all, in this flow chart you can easily see that baby born at 30 weeks. At 30 weeks baby took birth. So that what it means that baby is premature, and this premature baby have premature retina and vessels, and baby get two sources of oxygen after birth. So in the mother womb, so all nutrition comes from the placenta. Okay, but when the baby take birth, then he needs oxygen to survive. So due to the premature stage, there is need to supply oxygen to that baby for the proper development. So a well-developed baby can take up to 95 to 100% of oxygen, but for the premature baby, the oxygen level should be in between 90 to 95. So if the oxygen level production to the baby is less than 90, then the baby will die, and if it is more than 95%, then it will lead to certain complication to the retina. So the oxygen level should be at 90 to 95. So the baby is provided with oxygen in ventilation. Now the baby is when the baby come out from mother womb, he get two sources of oxygen. One is from atmosphere, another is from the ventilation, oxygen provided. So there will be some, in some cases, not all babies develop retinopathy of prematurity. There is some selected patients or baby who are premature that develop the ROP. So for them, what happens is that due to that excessive oxygen, there is VEGF active. That excessive oxygen is leading to vasoconstriction. Why? Because the more amount of oxygen lead to hyperoxia to that baby, and because of that hyperoxia, there is vasoconstriction of the blood vessels is there. So for that vasoconstriction, blood is not properly flow from the blood vessel. So to maintain that blood vessel, abnormal blood vessels start to grow. So that is the activation of VEGF. So these abnormal blood vessels are not properly formed. So what it ultimately lead to is that it ultimately leads to the rupture of blood vessel, and it leads to vitreous hemorrhage, and in the later slide or severe stages, it leads to tractional retinal detachment. Okay, so that is how ROP baby have those pathology of the retina. Now the stages that I was discussing, that there is 5 stages of ROP are there. One, that is stage 1, then stage 2, then stage 3, stage 4, stage 5. So all stages we need to know that how these stages look like, and how to diagnose, what are the properties of those each and every stage. Okay, first of all, in stage 1, the demarcation line will appear which separate the vascular retina posteriorly with the avascular retina anteriorly. That is the stage 1, where the demarcation line will appear. Now in stage 2, what happens is that a ridge is forming. So ridge means that the demarcation line become ridge shape. That means it have a height and width. Okay, and small isolated tuft or neovascular tissue, these are called popcorn. Okay, that will appear, and also neovascularization of the retina start in stage 2. In stage 3, the neovascularization extend from the ridge into the vitreous, and proliferation become more extensive in stage 3. Now what happens in stage 4? So stage 4 have two subtypes. One is A and another is B. So stage 4A, stage 4B. So in stage 4A, the retina start to detachment, but in stage 4B, then it involves the fovea. So there is different types of zones are also there. So to understand the basics of ROP, we need to know about the stages, we need to know about the zones, and we also need to know about the plus disease that I am going to discuss with you all. So here in stage 4, I say that partial retinal detachment. That means not, it is not the total retinal detachment, but it is the detachment of the retina starts. And at stage 4B, the macula also detached. And in stage 5, there is tractional retinal detachment. Why? Because the blood vessels are going to the vitreous also. So it ultimately leading to tractional or pull to the retina, which ultimately detach retina fully, so that there is tunnel shape is there. If we perform B scan to the baby, then in tunnel RD will be appear. Okay, so that is the stage 5. So first of all, in this picture you can see that there is a demarcation line you can see. So this is the avascular retina and this is the vascular retina. So this demarcation line is separating these two zones, avascular retina and vascular retina. Now here you can see that the demarcation line is becoming more dense. It is the formation of the ridge. So this ridge is having height and width. Okay, and also there is a tuft or popcorn like structure will appear, and from that new vascularization will appear. Okay, now here you can see that this demarcation line is become very tough, and also new vascularization starts, and here it is already started the RD. So this is the end of the stage 3, and it's stage of 4. You can see that in this part or here the retina is going to detach, so this part is not properly seen. So this is the stage 4. Okay, now here you can see, so by seeing this picture you can easily understand that what is the stage of this fundus. That's it is the stage 5, where you can see there is total retinal detachment, so that the structures or optic disc or macula is not properly seen in this picture. So this is the stage 5. Now You can also see that this is also stage 5 because there is total retinal detachment happen, and this is the tunnel RD is there. So why I am telling you about the tunnel RD, because tunnel RD means the retina is attached to the ora serrata and the optic disc. So at that portion, two portion, the retina is attached, but in the remaining portion retina get detached. So there is a complete retinal detachment, and the accumulation of the fluid over this area leads to this total retinal detachment. So the zones that I was telling you all, that what are the zones, to understand about the ROP we need to know what is the zones. Okay, so first of all, there is zone 1 is there, zone 2 and zone 3. So zone 1 involves from the optic disc to the macular distance and double the distance. Okay, so from the optic disc to the macula, the distance we will do double the distance, that is the zone 1. Okay, so zone 1 is the most sensitive one because it is involving the macula. Okay, and in zone 2 what happened is that from the zone from the border of the zone 1 to the near the ora serrata, so this is involving the zone 2. So I discussed with you all that in the zone beginning of the retinal development, within the 36 weeks the retinal blood vessel reaches to the nasal side. So this zone 2 is involving the nasal side of the retina, and zone 3 is involving the temporal side of the retina. So here in this temporal side the blood vessel reaches within 40 weeks of the baby. Okay, so baby is born in 30 weeks or 34 weeks, so that what it means that the blood vessels are not properly reached to this temporal part, which leads to detachment or avascular and vascular area. These two parts are separated made. Okay, so this is how it is done. So you need to remember what are the zones, and you also need to remember what are the stages of ROP. Yes. So in this slide or in this presentation, that's all. But apart from this thing, there is also plus disease also there that I was discussing with you all. That what is plus disease? Plus disease means additional sign symptom, that by looking at those sign symptom, you can easily understand that this is the case of what to say, retinopathy of prematurity. So let's look at the fundus. Here you can see the plus disease means the tortuosity of the blood vessel. So tortuosity means like this type of blood vessel, these are not look like normal. So normal blood vessel will look straight lines. Okay, but you can see the wavy pattern of the blood vessel is there. So this is the tortuosity of the blood vessel. So this is an indication of the plus disease. So in case of management purpose, that there is several types of management are available, but due to non or due to prematurity of the retina, there is due to certain reasons, due to premature baby, so the retina become underdeveloped. So the vision that is lost forever, and the remaining retina, we need to save that retina. Okay, so another thing I want to discuss with you all, that I discussed about the pathophysiology and etiology with you all, but in those who the children who are more prone to develop ROP are children who are born before 30 weeks, and also who are having weight less than 1500 gram. Okay, and in India the criteria are different. So in India it is said that if the child is born before 34 weeks, and if his weight is less than 1700 gram, then he can be at the risk of ROP. So it all depends upon the pediatrist or the child specialist, that he when he want to send the child for ROP screening. So this ROP screening is very much important to understand or to diagnose any type of risk factor that is associated with the prematurity. Okay, so another thing, what is the management? So ultimately the management is the main thing now. So in management, so there is activation of the vascular endothelial growth factor. To stop those abnormal blood vessels, we can try anti-VGF medication. But the complication is that those anti-VGF drugs, okay, so those anti-VGF drugs have a specific duration of action. So suppose 1 month or 3 months. So after 3 months, the new vascularization will again start. So this is not a permanent treatment, and we need to inject the injection again and again. So it is seen that in India, especially, some parents are not likely to do or to allow that surgeon to inject those anti-VEGF medication again and again to their child. So the permanent treatment is pan-retinal photocoagulation, where the area of this neovascularization area is burned out, so that if there is accumulation of the VGF, it will not grow. That means those abnormal blood vessel will not grow. So this can be a treatment option, uh, so that to make the retina safe, because the vision lost is lost forever, but the vision that is remaining, we need to save that vision. It doesn't matter that the child is having a tunnel vision or an only central vision, but he is having that vision that is very much um, ex- uh, uh, but many children who are having high risk of ROP, they develop blindness. But we can save the vision by the proper what to say screening. So to spread more knowledge and awareness about this ROP, and if there is any what to say premature baby born in your locality or in your knowing person, just send them to the specific or eye hospital for proper screening. Okay, so that's all, friends. Thanks for watching. Please don't forget to like my video and subscribe to my channel. Please don't forget to hit the bell icon so that you will get notification whenever I upload a new video. Thank you so much.